Good evening, all. Good evening, all. I'm Dr. Achuth KS. I have done my MBBS and MD in PSM. Welcome back to Auricle. This is our third class on PSM. Welcome to the 90 days University Proff Final Mastery course of Auricle, which is an excellent rapid revision for all important questions with deep facts and most expected topics are covered in this in these sessions. And this is beneficial and used for all your university exams as well as next exam and your NEET exam also. You know the core concepts, you will be covering your NEET exams also. Today's class would be on 5 questions. That is, long essays will be discussing about epidemiology of malaria and briefly about its prevention and control, and epidemiological clinical features and control measures for dengue in India. And in short answers, we'll discuss about dengue hemorrhagic fever, mass chemotherapy, and differentiate between extrinsic and intrinsic incubation period. Okay. Next, we have 5 ways of teaching in Auricle, that is recorded classes, live classes, practical session, exam module, hard copy book set. You can use recorded classes whenever you go on the go or when you are travel or you're just listening like a podcast. That is also fine. It gives you some amount of knowledge to catch up, and it is a convenient way of revision for you without any obstacles. We provide in-depth coverage of all the topics, mostly previous year questions of last 10 years, which are more anticipated or more expected to come in your exams. And it has been that will be taught by experienced educators who are not less than 10 years of experience. And the sessions will be very interactive. It will not be monotonous. It will be interactive. You can clear your doubts, how small they are, then and there itself. And why it is more important, it helps in your MCQs, Viva OC, and practical exams also. We have an express exam module, which is such designed to cover the entire syllabus in 20 hours. It is a comprehensive one, which is more efficient, like a small bullet with too much of impact. And you will be taught how to write the answers by our expert educators. And they give you the exam strategies, how to frame an answer so that you can impress your examiner and get good marks. Okay. We have one-to-one clearing sessions also, which is completely student oriented. Personalized attention will be given to all the students, and you have a safe learning environment. You don't have to get fear or you don't have to get shy while asking the question. You don't have to feel anything. It is your doubt, it is your doubt. Go ahead and straightly ask it. Apart from this, you can revise for your exams with the hard copy notes, which is provided by the Oracle, which is very comprehensive and gives all the 10 years question papers so that you can revise it fast and furious types, and you have an interactive learning. After that, you come up with your hard copies. You can discuss if still any doubts are there, you can discuss with your educators. You have a question bank also with this, with 3 levels, that is beginner to expert level, which is customizable for all the students, which contains questions of university exams, that is prof exams, NEET, and FMG. So you are given an overall coverage of all the 3 exams. You will have practical sessions, hands-on experience. You will be taught how to answer in your Viva OCs and how to answer your practical questions. And it will be done by our seasoned, well educators who are professionals in these, so that you go into your exam halls during your practical sessions with confidence. We have 4 subscription plans. That is foundation plan, which is around 19,999. We have an advanced learning plan for 6 months, which is 32,999, and a complete learning plan for 1 year, that is 59,999. Whereas the ultimate MBBS plan, which we take care for your whole course, that is around approximately 1.9 lakhs. Not but not the least, you will have a discount code too. That is the cream over the cake. You have a 20% discount code, which has been displayed in your screens. So please use it and go and buy your Auricle subscription so that you will secure your future. With this, we will start our class today. We will discuss epidemiology of malaria and briefly about its prevention and control. I'll give you the small entertaining tactics how to remember everything about mosquitoes later. Okay. What is malaria? It is a communicable disease caused by protozoan parasites of genus Plasmodium, and it is transmitted by a female mosquito to man. Which female mosquito? Does all female mosquito transmit malaria? No. Female Anopheles mosquito, which is infected with malaria's protozoas, are only going to transmit the malaria to human beings. Whereas male Anopheles mosquito feed on plant juices. So it is only the female Anopheles mosquito which bites and drinks blood. And the disease is characterized by remittent and intermittent febrile paroxysms, that is fever episodes occurring on alternate days or daily. A typical febrile episode, what does it has? It has cold stage, hot stage, and sweating stage. We call it as cold, hot, and wet. In cold, hot, the patient has chills and shivering. He feels like to wear sweaters and covered with blankets and quilts. Followed by a hot stage, he just removes everything and throws it away. After that, he feels so relaxed and he starts profuse sweating and he feels relaxed. After the sweating, again the cold stage starts. This is a typical cycle of malaria infection. And the most important thing which you have to write in your exams when you get any disease of communicable disease, that is epidemiological triad. Please do not forget this. Agent, host, environment is most important. The agent factors, which is caused by Plasmodium. It is a hemoparasite of parasites of genus Plasmodium. There are 4 species: Vivax, falciparum, malariae, and ovale. In this, Vivax and falciparum are most commonest. Malaria it has focal distribution. That means it has local. It happens in one part of the district, but not the next district. It appears like one flower in every 50 kilometers or 30 kilometers. When you imagine a flowers in every 50 kilometers, it appears like that. It is a very focal distribution. Whereas ovale is very rare. If you are getting this, that means there's something wrong with the public health system. And the mosquito has 2 life cycles: cyclopropagative life cycle. That is, there is a sexual stage and a asexual stage. Sexual stage happens in mosquito. Asexual stage happens in humans. That means it has 2 posts. Okay. This is the life cycle of mosquito. Where shall we start from? We shall start from the humans or we shall start from the mosquito? So we'll start from in the clockwise. We'll start from 12 o'clock. Okay. Sporozoites. When mosquito which is infected with female Anopheles mosquito is infected with protozoas, malaria protozoas, they are called as sporozoites. Sporozoites in saliva from mosquito are injected to human host while it bites. We'll see later when it bites and how it bites. Once these sporozoites are entered into the human blood, they go exoerythrocytic multiplication. That is in multiplication in liver parenchymal cells. That is exoerythrocytics, that is outside the blood cells. and whatever the byproduct, that is the protozoal product, is released, they are called as merozoites. These merozoites enter the blood cells and form ring trophozoite. Ring trophozoites undergoes maturation. Just a minute. Yeah. This ring trophozoites undergoes maturation and it becomes a schizont. Once it becomes, again, this immature undergoes maturation to become merozoites. That means there is two cycles in humans also. One is exoerythrocytic cycle and one is erythrocytic cycle. Okay. In this, there is no features or symptoms, sorry. And in this, we have clinical symptoms. When sporozoites are injected to human body, they enter liver cells, then multiply and they become merozoites. These merozoites enter that is red blood cells and become ring trophozoites. These ring trophozoites again get matured into trophozoites. Trophozoites will become schizonts. Schizonts will become maturation to become merozoites. So there's a multiplication here also, and there is a maturation here. Now, this ring trophozoite can get differentiated into two, that is microgametocytes and macrogametocytes. Okay, that means these are required for sexual phase of the parasite, sorry, protozoa. One microgametocyte and macrogametocyte, they undergo differentiation, and once the mosquito bites, whether it is infected or uninfected mosquito doesn't matter, when it bites, these two enter into mosquito and they undergo fertilization to form a zygote. This zygote forms eukinete, that is motile, which can move freely in the mosquito, and it penetrates the outer layer of the stomach. Till now, all these things were happening in stomach of the mosquito, not in human body. It is in the stomach of the mosquito. Now it penetrates, it tears off the stomach wall of the mosquito and encysts, and it will form oocytes. It will tear the stomach wall of the mosquito and forms a cyst like this. And in this, they form oocyst. This is oocyst, and there will be sporozoites in this. This gets burst, and these sporozoites are released into the mosquito body cavity. Then they swim through the body cavity of the mosquito and come to the salivary glands of the mosquito. When they reach the salivary glands of mosquito, if they bite the humans again, then those sporozoites are released into human body. That life cycle is very simple. You just have to imagine. Once you imagine, it stays in your mind perfectly. There are two phases, that is exogenous phase and endogenous phase. Exogenous phase happens in mosquito, which is a sexual cycle, and endogenous phase happens in humans, which is a asexual cycle. That means there is only growth of the mosquito cycle. There is no fertilization in human body. We'll start from sporozoites again. Sporozoites, which are injected into human body on bite of mosquito, will undergo multiplication in liver. That is exoerythrocytic cycle outside the blood cell. On multiplication, these are called as merozoites. Since multiplication is happening in liver, you will have one of the signs, that is hepatomegaly. Before the fever, the hepatomegaly can also occur. Once these merozoites are formed, they enter the blood cells, RBCs, and they form ring trophozoites. Ring trophozoites, again, they can get differentiated into three. One is mature trophozoite, microgametocyte, and macrogametocyte. If it becomes trophozoite, it stays in the human body to become immature schizoid. This immature schizoid gets matured like a growth of a child. And mature schizoids again becomes merozoites. And again they infect the blood cells. By chance, this ring trophozoite gets differentiated into microgametocyte or macrogametocyte. They are the ones who form the zygote. But when these gametocytes have to enter into the blood of from the blood to the mosquito in the same way as microgametocyte and macrogametocyte for fertilization. Once the mosquito bites, they enter into the stomach of the mosquito and they form a zygote. And this zygote starts moving easily and freely with the freedom to form ookinete. And it forms a cyst over the stomach wall of the mosquito. They burst out and this oocyst comes out forming sporozoites. These sporozoites run freely along the body cavity of the mosquito and reach the salivary glands. Once they reach the salivary glands, during the bite of the mosquito to a human being, these sporoids get into the human blood. This is the cycle which goes on. So when you think of prevention, you have to think of prevention somewhere here in this whole cycle, how to control. If you able to remember this cycle, of your prevention and control will be solved. Okay. Now we come to the next topic, that is reservoir of the infection. There is only one human reservoir, only one reservoir, that is humans. But there is an exception. We are descendants of someone, so they are also vulnerable for this infection. Those are chimpanzees in tropical Africa. Monkeys of India. It is the chimpanzees of tropical Africa. Period of communicability. Once the gametocytes mature and present in sufficient density in the human body, vivax, the communicability starts. Till then, if it is not in the sufficient quantity or the density or in the blood, the gametocyte doesn't get matured. And vivax appears in peripheral blood 3 to 5 days after the initial appearance of asexual form of parasites, whereas falciparum infections, they do not appear till 14 days. That means the asexual forms of vivax appears early in the bloodstream compared to falciparum. Why we are discussing vivax and falciparum? Because they are the most commonest. Malaria happens here and there, and oval is very rare. Okay. Coming to the host factors, who are affected? All ages are equally affected. No gender difference. There is a race difference. Black people with sickle cell trait are immune to malaria because of the HP, whereas G6PD deficiency suffer more from vivax infection compared to falciparum, oval, and malaria. Economic status, low socioeconomic status, and poor lighting. Poor lighting, more mosquitoes, and low socioeconomic status, less hygiene, accumulation of water here and there, and no affordability to have a mosquito net or proper meshing of the doors and windows. Again, there's mosquito bites. Movements, like we have a country which is a developing country, many of the laborers who move from northeast or the states of Bihar, Orissa to the urban cities for jobs and their livelihood are also a part of transmitting disease from one geographical area to other geographical areas. And other habits what we have in India, which I used to do when I was a kid, sleeping outdoors. Why? In summers, we tend to sleep outdoors because it is very cold and we don't have to use fans or ACs, and affordability was also a big question. And ignorance. When most of the times we used to ignore that mosquito does nothing, it just bites and goes off. But after so many years only we realize that actually mosquitoes can do so much of things and it can take a life with such a small being, such a small living being. It can take a huge human being on its own. And there is no natural immunity. Maternal antibodies provide immunity for first few months of birth. and later the susceptibility of the child will be same as any other. Coming to the environmental factors, environmental factors actually plays a very big role in spread of the infectious diseases, that is malaria, dengue, chikungunya and all. Malaria happens usually during July to November because of partial waterfall rainfalls and very cool temperature, not very high temperature during July and November. It stays hardly between 24 to 31 or 32. But the rain during this temperature causes higher humidity. And during the humidity, if the humidity is higher, mosquitoes are more active. Which are the most humid places in India? Western coast, eastern coast areas, northeast areas, northern parts of the country like northern parts of Punjab, southern parts of Jammu Kashmir, Haryana, Uttar Pradesh. These are the high humid areas during the June, July, and August, even September also, where we have the temperature is also high and humidity is also high. Whereas in September and August, the temperature comes down, whereas the humidity remains same. So in these areas, the mosquitoes are densities are higher. And rainfall gives a very good opportunity for breeding. But if there is heavy rainfall, then the larva gets washed away, so they don't grow. That is the logic behind this. And high altitude areas does not have mosquitoes. If it is more than 2,500 meters from the sea level, it is very unlikely to get the mosquitoes because of the oxygen levels and the temperatures. Usually cold temperatures, not so humid. So it is very rare to get the mosquito breedings in a higher density. Apart from this, the major culprit is man. Why? We do lots of constructions and we throw bottles everywhere after drinking water. We have constructed so many dams to store water. All these places are very good sources for multiplication of mosquitoes. What are the vectors of malaria? Malaria does not cause, falciparum does not cause malaria on its own. It needs a vector or a transport mechanism. That is the mosquito. There are 63 species of Anopheles mosquito, but there are only 6 primary vectors or 3 to 4 secondary vectors in India. And they rest inside the home and outside the home. If they're resting indoor, we call it the mosquito is endophily. If it is outside, we call it as exophily. In this case, it is both. When does it bite? During dark time, between dusk and dawn. And how far it can fly? Actually, they can go to a very good distance. Anopheles bamai, which can go up to 500 meters. Minimus and fluviatilis, which can go up to 1 kilometer. Facies and Stephensii can go up to 2 kilometers. And Sandicus actually can go up to 8 kilometers, which is actually huge. Okay. For an individual of 20 to 25 years age group, running for a 5 kilometers is a very basic difficult task. But Sandicus mosquito can actually fly for 8 kilometers, which is actually commendable. Where does it breed? Slow moving water, seepages, terraced rice fields, brackish water. Where are the slow moving waters? Coastal areas, we have slow moving waters in the hilly regions, not so hilly regions to call it as high altitude, but they are hilly regions. And seepages, terraced rice fields, which are clean water, and brackish waters in Kerala, of that is towards the sea water, where the sea and the rivers meet. Most common species are Fluviatilis and Sandicus. The other places are wells, cisterns, and overhead tanks, where Stephensii is more common. Pools, burrow pits, sterns, slit trenches. In this, Philippensis, annularis, and bamai are common. So where there is a clean water, there we can get Fluviatilis. Sorry, Anopheles mosquito most commonly. What is the distribution of this mosquito? Northern and peninsular India, we have Culicipacis and Stephensii as the major ones. In local, we have Fluviatilis, Sandicus, Annularis, and Varuna. In eastern India, it is Dirus, Maculatus, and Sandicus. Philippines and Minimus. These are the 5 species. In Andaman and Nicobar Islands, we had only Sundicus, but we have found other 2 species also, Maculatus and Tessilatus. How did they go there? Because we do travel, so somehow we have transferred from here. We have given the immigration for them from the countries to the islands. What is the mode of transmission of vector malaria? The first one is by vector, that is mosquito bite, direct and congenital. In incubation period, we have different incubation for different species. 9 to 14 days for falciparum, up to 17 days for vivax, 18 to 40 days, that is 1 month for cotton malaria, and 16 to 18 days for ovale. So everyone has different. You can go ahead and write the average incubation period in malaria for all the species ranges from 9 to 14 days. 40 days. 10 to 40 days is the average which you can write in your exams. Easy to remember. Now, coming to the clinical features, which is one of the important, it can come as one of the short answers, give the clinical picture of malaria. It happens in 3 phases: cold stage, hot stage, and sweating stage. First, during cold stage, there is onset of headache, nausea, and chilly sensation, which lasts for 15 minutes to 1 hour. Individual feels like wearing sweaters, covering himself with thick blankets, bed sheets, etc. But after this stage, we feel so hot, the body temperature goes to 39 or 40 from 36 or 37. And it removes everything what he used to cover himself. And there is tachycardia and bouncing type of pulse, which lasts for at least 2 to 6 hours. Imagine the plight of the individual during this. But soon there will be a sweating stage. The fever comes down drastically, and there is a profuse sweating. His clothes and bedsheets get watery. Body temperature falls, pulse becomes lower, and he feels relaxed. And this lasts for 2 to 4 hours. So the cold stage, hot stage, and sweating stage are the 3 steps where the malaria infection takes place. And during the life cycle, we saw when there are murozoites are released from the blood, that is, trophocytes are getting released and they get matured into schizones, we have a clinical pictures. This cycle, during that erythrocytic cycle, you get all these things. Okay. And after the sweating stage, you have again another cold stage. So the total duration varies somewhere around from 15 minutes to 11 hours. Starts from the total duration varies from somewhere around, 2.5 hours to 11 hours. It can happen anywhere in between these. Coming to the diagnosis, there are 3 ways. One is microscopy. You make a thick film and thin film and examine for ring trophozoites. And serological tests, we have rapid diagnostic tests nowadays, so that we don't have to wait for the smear reports for diagnosing it. Coming to the prevention and control. First, we'll go through the slides and I'll tell you next how to write an answer on your own. You don't have to mug up this prevention control of mosquitoes anytime. One is stratification of problem. First, you have to identify what is the problem of mosquitoes, how big is the malaria problem. Second is vector control strategies, that is antiviral measures and anti-larval measures. And we'll have something called prevention, okay, in human beings, that is self-control everything. Now you can take down this answer, but I will tell you how I used to remember the answer. Okay. There are 3 parties in this. One is mosquito, 2 is malaria parasite, third one is human being. So you can't do anything to this malaria parasite. So we'll wait out this malaria parasite as of now, because we can kill only by treatment. So that becomes an intervention. It does not become a prevention. Now we have mosquito and human being. For simpler thing, we have 3 M's: mosquito, malaria parasite, and man. So in 3M, one is gone. We have only 2 M's now. That is mosquito and man. So either you kill the mosquito or you protect the man. First, we will kill the mosquito. How? Mosquito has 4 phases. That is adult, egg, larva, pupa, and adult. Egg, larva, pupa, and adult. Okay. First is the egg. For the mosquito to lay egg, you need a water body. So identify those water bodies and close them. So there is no place to lay eggs. That is one measure. If you have missed by any chance that water bodies could not be closed, you do one thing. Eggs are laid, kill that larva. How will you kill that larva? By using larvicides. Those are deltamethrin, and there's something called BTC also, Bacillus thuringiensis. When you use this larvicides are killed, so the adult mosquito does not form. Now there is an adult fellow. Now you have missed 2 stages. That is, you have allowed to lay eggs, and there is a development of larva also. So there is an adult which has come out already. Now we have to kill this adult. How? By using adulticide. How do you kill this adulticide? On 2 ways. One, where does it sit after biting you? On the walls. So you spray the chemical on the wall, adulticide chemical on the wall. What are the adulticides used on spraying on the walls? That is malathion and fentothion. This is called residual spraying. Why? Once you have sprayed the chemical on the walls, whatever is the leftover on the walls is called residual chemical. That is why it is called as residual spraying. Apart from that, mosquitoes are flying, so you have to control that space also which they are flying. Now you will use fogging. That is called space application. There is one more, that is ultra low volume fogging. That is also used for space application. Now you have controlled that is breeding of mosquito. 1M is over. Now we have a second M, that is man. How will you protect man from this? Use mosquito nets, use repellents, educate them, create awareness. So you will write all these things. Use mosquito nets, use repellents, health educate, and awareness, and use mesh for all the doors and windows. From this, you can control and prevent malaria to a very great extent. This is how you should write an answer. You can copy this, but this is a very easy way to remember. 3 M's: malaria, man, and mosquito. Malaria, you can't do anything apart from killing by giving medications. So it becomes an intervention. So it is not a prevention and control. Now, the second one is mosquito and man. Mosquito, you know how to reduce the breeding and kill the adult mosquito on larvicide. Third one, man, you protect from the mosquito. How? By using mosquito nets, repellents, and educating the people and children. Okay. If we use all these things together, we call it as integrated vector-borne disease control. Okay. This is what is called integrated control. This also you can take it from your PARC textbook. What you have to do for your indigenous and community protection, I've already told. Environmental sanitation, that is eliminating of breeding sites, health education, use of larvicides in water bodies, insecticide treated nets, that comes under personal protection, indoor residual spraying for adults, ultra low volume sprays for outdoor spraying, and insecticide treated nets again as a in personal protection at the larger level. Okay. Now we will come to a second question, that is describe epidemiologic control features of dengue in India. I will be going a little bit faster because the control of measures of dengue mosquito is also similar. We'll describe the epidemiologic and clinical features in detail. Dengue is a acute febrile illness characterized by severe muscle and joints pain and a rash. Fever, muscle pain, joint pain, and a rash. All these 4 things are common in dengue. The most characteristic is pain behind the eyes. That is called retroorbital pain. How long does it last for? 5 to 6 days, and it stops on its own. This is the introduction we have to give. How does it appear? Epidemiological factors. Again, agent, host, and environment. Please do not forget. We'll come to the agent. It is the arbovirus, arthropod-borne virus, belonging to flavivirus group, and it is called as dengue virus. There are 4 serotypes, 1, 2, 3, 4. All can cause either dengue fever or its severe form. That is dengue hemorrhagic fever. It can cause either dengue fever. 1 can cause dengue fever, 2 can cause dengue fever, 3 can also cause dengue fever on its own, 4 can also dengue fever cause. Or it can cause in combination also. This is the worst character of dengue, which is a vector, that is Aedes aegypti, which is a day biter. It can bite at any point of time, and it is not afraid, and it pains a lot, and it can bite you multiple times, and it really pains. You will get boils over your skin, rash, big red rash over skin once it bites. Why does it happen, and why does not happen? How can you have a multiple bites in Aedes and not in Anopheles? Please check. There is something called anesthetic effect in their needles which are used for piercing the skin, which is not there in Aedes aegypti. It is only there in Anopheles. So Aedes aegypti bites multiple people in the same day. That is why dengue spreads faster than malaria. Mode of transmission. Virus multiplies by propagative development in the stomach of female mosquito, and its transmission occurs through bite about 10 days after taking a blood meal from a case of dengue. That is, infected mosquito can only cause you dengue. There's a special characteristic of this also. When the dengue, that is virus, is being entered into the female mosquito of Aedes, when this Aedes aegypti lays eggs, the virus is also transmitted in those eggs. It not necessarily it has to come and bite to get infected. The mosquito which is born out of the eggs of the infected mosquito can also cause dengue, which is geometrical multiplication of dengue cases in community. So that is why it is a public health problem. Huge. Host factor, there is only one reservoir, that is man. No healthy carriers, no natural immunity. It means that first infection gives the immunity for the first one, but first type of infection, dengue CS, one type of infection does not provide infection immunity for the second one, second serotype. That is the worst one. Recovery from infection provides lifelong immunity for that virus serotype only, particular virus serotype, not for the second, third, and fourth. If the second one is getting infected first, it does not provide infection for 1, 3, and 4. Okay. And if you are getting infected with the dengue type 1, if you have infection from 2, 3, 4 later, it causes more severe illness. Why? Reaction of immunity. Okay. Who are high risk patients? Infants and elderly because of low immunity, obesity people, pregnancy, again, they are the high risk factors. Peptic ulcer disease, G6PD deficiency, congenital heart disease, and who have chronic health diseases. Chronic health diseases, diabetes mellitus, hypertension, asthma, liver cirrhosis, ISD, and chronic renal failure. All these form high-risk patients for contracting dengue disease. Okay. Remember the 7 points which are very much important. Environmental factors. Now already know how does it affect in malaria. Same here also. During rainfall, relative humidity of 60 to high 80%, anywhere above 60% of humidity is high humidity. It is a domestic breeder. That means it can breed in your flower vases, small water caps, and cooling systems, that is air coolers, ACs where the water is collecting and the ducts, and they are both endophagic and endophilic. They can live outside also and inside also. Okay. Communicability period. If the infective mosquito bites, during the first 3 days of illness. Mosquito remains infective for all of its lifespan, that is 3 to 4 weeks after it becomes infective. It is not that mosquito, the virus dies inside, it is evergreen. And the incubation period ranges from 3 to 15 days. Okay. Clinical features. We have peculiar clinical features. Once there is a dengue virus infection, it might be the individual might be symptomatic or asymptomatic. If symptomatic, there is an undifferentiated fever. Until unless you do some investigation, it just represents as viral fever, or it gives the character symptoms of dengue fever with or without hemorrhage. If it is a serious one, we call it as dengue hemorrhagic fever with plasma leakage. There might be shock or there might not be a shock syndrome. And if there is any involvement of organ failure, we has expanded dengue syndrome. Okay, if you remember this chart, please do write it. You can fetch very good marks out of this chart. We'll go one by one. Undifferentiated fever. When the infection is for first time, it looks like a more viral fever and people tend to neglect it. And there's a rash that is maculopapular and upper respiratory and GI infections, which are common in the first infection only. Classical dengue fever, all ages and genders are susceptible. No differentiation between any age or gender. Incubation period, again, common 3 to 10 days. Straight away, if you don't remember anything in incubation period for dengue, write it as 1 week. 1 week to 10 days or 1 week to 2 weeks. Nobody, you will not go wrong anytime. Symptoms, chills, high fever, headache, very badly intense headache, muscle pain, joint pain, retroorbital pain is characteristic. These three are very much characteristic in dengue. Photophobia, other symptoms like you feel like normal fever, that is weakness, anorexia, constipation, loss of taste sensation like simple viral fever also. And there's a rash which lasts for 2 hours to several days. You can see rash for only small amount of time, 2 to 4 hours, but you can see it for so many days also, 3 to 4 days also. This is classical dengue fever. Coming to the dengue hemorrhagic fever. It is a very severe form. We have febrile phase, critical phase, and recovery phase. Febrile phase, we have sudden onset of fever, headache, bleeding in mouth and nose, muscle and joints pain, vomiting, rash, and diarrhea. In critical phase, we have hypotension, pleural effusion, ascites, GI bleeding. These are all critical features. Why? Means there is a loss of body fluid into the third space in your body, which is very critical, where it can go into organ failure. And we have third phase, that is recovery phase. There is an altered lens senses in the individual. He might throw seizures, itching all over the body, and bradycardia. These are the 3 cases of dengue hemorrhagic fever. You should write something about tourniquet test. How do you do a tourniquet test? Take the blood pressure of the individual, record it. For example, you might get 100 as systolic and 70 as diastolic. Now take an average of this. It comes as 85. Now inflate the cuff to a point midway between systolic and diastolic for 5 minutes. That is, maintain the blood cuff pressure for at 85 mmHg, 85 mm of mercury for 5 minutes. Reduce after 5 minutes and wait for 2 minutes. If you find petty K in 2.5 into 2.5 centimeter area, that is 1 inch into 1 inch, 1 square inch. If the petty K dots are more than 10, then it is positive. 10 or more than 10, it is positive. That means the platelet level is going down. If there is no 5 to 6 or petty Ks or 7, you can call it as negative. That means the platelet level is normal. This is one of the ways of diagnosing whether the individual requires platelet transfusion or going into a critical phase also. Coming to the dengue shock syndrome, these are these features which are very much important. You have to write in your exam. That is tachycardia, cool extremities, capillary refill is low, weak pulse, lethargy and restlessness, and reduced pulse pressure and hypotension. Please do not forget these features of dengue shock syndrome, which is very much important for diagnosis. Coming to the control and preventive measures. Vector control, personal protection, vaccines, and other measures. I've already told you, apart from these, how to write an answer. We have man, mosquito. Now we have D, that is virus, dengue virus. Dengue virus, you can't do anything. We don't have antivirals for this. There are some vaccines which are there. We'll discuss it later. Only one vaccine is there, in fact. Now we have left with two, that is mosquito and man. Mosquito. How do we kill mosquito? By using adulticide, space spray, and residual spray. Okay. Space spray by malathion or fentothion or ultra low volume spray. That is ULV. Residual spray, malathion 50%. Space spray you can have malathion 95% technical. Coming to the man, sorry, in this adulticide you have used, now we'll use the larvicides to kill the larvas. First, how to kill the larvas? Use the larvicide, that is malathion 50% spray or deltamethrin 2.5%. Deltamethrin 2.5%. If you don't want to use the chemical, remove the water bodies or use the fish, gambusia or guppy. In malaria also you can use, they just eat on mosquitoes and live their life by feeding on larvae of the mosquitoes. That is one of the natural ways. Two natural ways, one is using fish, gambusia and guppy. The other one is eliminating. That means if there are burrows or pits, just fill it with earthen or soil, it will and not automatically kill the larva because of non-availability of viable environment. And how to avoid laying of eggs? Identify the water collection bodies and clear it off. And for man, you have to protect yourself from mosquito biting. Wear light colored clothes, full sleeves. A common saying, sun down, sleeves down, because the mosquito bite increases during the dusk and dawn. Even though it is a day biter, the intensity of biting is more during dusk and dawn. So sundown, sleeves down. Full shirt, light colored clothes does not attract mosquitoes. And use repellents to show them away. Apart from that, while sleeping, use mosquito nets, insecticide treated mosquito nets to kill them and protect yourself. Education, awareness. These are the things which are important for control measures of dengue. Now, surveillance. Purpose of surveillance is to obtain the information how bad it is. We have something called house index, container index, and duty index for larval survey, and we have adult surveys also. House index, percentage of houses or premises of Aedes larva, percentage of water holding containers for Aedes larva. Duty index, number of positive containers per 100 houses in specific location. Okay. Vector control, I have already told you. Adult control, larvicidal control, and preventing the laying of eggs. Personal protection, either you protect from the mosquito or kill the mosquito. Personal protection is wearing light colored clothes, using mosquito nets, insecticide treated nets are the ones. Okay. There's one vaccine which you should remember. There is CYD-TDV vaccine, chimeric yellow fever virus, and dengue V tetravalent dengue vaccine. Okay. It is a prophylactic tetravalent, that means contains all 4 serotypes and is a live attenuated vaccine. 0.5 ml is given, 3 to 6 months interval duration. That is, it is injection. And it is stored at 2 to 8 degrees Celsius for 36 months. That is the shelf life. Okay. This one vaccine you should remember, which has been tested in Africa and Brazil as of now. And it might come in the future also. Coming to the short notes. First, we'll calculate the annual parasite incidence and what is the current APA in India. Annual parasite incidence is a key measure to assess the epidemiological measure of malaria per thousand population in a given area, fixed area. What does it do? It helps you to measure the intensity of malaria transmission. If you say that API is 2 per thousand population in a year, then we characterize that area as high risk area. If it is less than 2, it is low risk area. The moment you say it is 2 and high, there is requirement of public health intervention. And the public health body should move to that area to check the breeding sites also. Okay, how does it is calculated? That is calculated by the formula. Number of confirmed malaria cases in the year by total population at risk into 1000. How does it confirm cases? Positive blood MER or rapid diagnostic. Both are considered. Population who are at risk while the malaria transmission is possible. Where malaria transmission is possible. Total population at risk, you can't say that there are take confirmed cases only for a state of Andhra Pradesh and I'll take population of whole India. No. When you take confirmed malaria cases for Andhra Pradesh, you will take total population of Andhra Pradesh itself, not the whole. Okay. Comparing the like things or using the like things to calculate the accurate results. Okay. The current API in India is 0.13 as per the National Vector-Borne Disease Control Program of 2022. That means low risk. Coming to the next question, that is mass drug administration in filariasis control. This is a modality of preventive chemotherapy. That means anti-helminthic medicines are administered to entire population irrespective of their infection status at regular intervals. It was started in 2004. Initially, only one that is diethyl carbamazine was given. In 2007, it was given with albendazole. 2 drugs was given. In 2018, there was introduction of ivermectin in 5 selected states and only in selected districts of those states. Currently, it is 21 districts of 5 states where this triple drug therapy is introduced. That is ivermectin, albendazole, and DEC. Okay, what is the dose? For less than 2 years, you will not give anything, neither albendazole nor DEC. 2 to 5 years, 100 mg of DEC and 400 mg of albendazole. You will get the tablet in fixed dosage forms. That is 100 mg of DEC and albendazole of 400 mg. So albendazole is same across all the age, that is one tablet. What you have to remember is for DEC, 2 to 5 years, one tablet, 6 to 14 years, two tablets, above 15 years, three tablets. Okay. How is it taken? It is taken once a year on identified day, that is National Filaria Day. And before giving the tablets, you have to do at least 2 visits to ensure that all the households are enumerated and there is very good rapport is developed between you and the individual so that you can get them convinced for giving the drugs. What is mopping up? In mass drug administration, you do daily visits to assigned areas after giving the MDA to cover the absentees who have missed the medication and to identify the side effects and provide them the symptomatic treatment of if you want to refer if there is any allergic reactions. Okay. And to maintain your records, it becomes easier. This is called as mopping up. You can use the strategy of mopping up in pulse polio also and major Indradhanush also. And we have a last question for this day, differentiation between extrinsic and intrinsic incubation period. What is incubation period? It is a time interval between invasion by an infectious agent and appearance of first sign or symptom of the disease in question. Okay. If it is also known as intrinsic incubation period in reference of vector-borne diseases. There's a bacteria or a parasite which is entering into a body. From that day till you develop a fever or malaise or body pain, joint pain, that duration is called incubation period. In reference to vector-borne, it is intrinsic. What is extrinsic? In reference to vector-borne, time necessary for the development of disease agent in arthropod. Malaria is getting developed in arthropod, that is in the mosquito, that is the extrinsic incubation period. Okay. That is from gametozoid to sporozoids. Extrinsic, the gametocytes going into the mosquito stomach and they get zygote, ookinete, and they become sporozoids. This is extrinsic incubation period, exogenous phase, and whatever happens in the human body, that is endogenous phase. From sporozoids to merozoids to ring trophozoids, again to gametocytes. This is intrinsic incubation period. During this, there is a development of symptoms also. So the first day of infection of malaria from day one, that mosquito is bitten today and injected sporozoids into my body. And when does I develop the first symptom, that could be fever or chills or anything, that period is called as intrinsic incubation period. Okay. If you have any doubts, please do come back and raise your questions with the learning manager so that it can be cleared on time. Thank you so much for watching. I think I have overshot the time by at least. No, I have not overshot time. I have finished it in less than a minute of an hour. And thank you so much for watching Auricle. Please do download Auricle app on Google Play and App Stores. You can watch our social media handles on YouTube, Instagram, Facebook, and even Telegram too. And I personally like Telegram because you can get lots of learning material. Please do subscribe to Auricle and get your good discounts and happy discounts. Use the code which was shown below. Thank you for watching.